They call themselves long haulers or long tailers. Some have been sick almost as long as the new coronavirus has been around. COVID-19 is causing more long-term damage than thought.
I was diagnosed with some blood clots, smaller blood clots in both my lungs. Then I got a lot of respiratory problems. The doctors just do not understand why I've still got blood clots, but I want them to find out what's going on.
After COVID-19, I lost almost half my hair.
We hope the majority of the lesser symptoms will disappear after a time, but as with the first SARS pandemic, we'll almost certainly witness permanent health issues, but to what extent is unknown.
Thousands of people of all ages are staying sick for weeks, even months. A study by Denmark's Aarhus University found a third of corona patients suffered long-term side effects. For some, the virus just comes and goes, or just doesn't go, rather. It stays. The disease can damage the lungs, heart and brain, increasing the risk of long-term health problems.
Susanne Helferich and her husband, Peter Kühn, were among the first people in Germany to contract the coronavirus back in March. As they emerged from quarantine 2 weeks later, they thought everything would be fine. But we were wrong. Because even now, 5 months later, Susanne Helferich is still suffering from the effects of the virus. Before, she was very active and highly sporty. That's all changed. I'm very tired. I can easily go to bed and fall asleep at 8 o'clock. That wasn't the case before. And that's the main problem, the tiredness. It's really debilitating. She's not alone. Many doctors say they see patients who are struggling to fully recover after an acute coronavirus infection. We're seeing patients who are dogged by health problems for weeks, even months afterwards, even though the virus is no longer present and they should actually be healthy again. Nicole Haske also suffers from exhaustion. During her illness with coronavirus, she lost her sense of taste and smell. 3 months later, she can still barely smell anything, not even her morning coffee. It's very limiting because I can't really explain it. It's something that really affects my quality of life. The cause could be an impairment in the olfactory bulb. During the SARS outbreak in 2002, experiments on animals showed the virus could work its way through the nerve endings in the linings of the nose and the olfactory nerve to the brain's olfactory system before heading on over the synapses. It's likely that this can also occur with COVID-19. It could be that some of these patients have actually suffered some brain damage, because with patients who present only with impairments to their senses of taste and smell, which is a common neurological symptom, when we investigate them with MR imaging, we can see damage to the olfactory bulb. The psychological stress caused by the pandemic could play a role too. Nicole Haske hopes she'll one day return to her old self. But she says her brother's experience has scared her. My brother didn't have any proper symptoms, and he's only started to feel really bad since he recovered. He has pains in his joints, his knees really hurt. He constantly has the feeling that he's out of breath. As yet, no one knows what is actually causing such symptoms or how long they could go on for. Researchers across the globe are working to come up with answers, but it'll be some time before they have them.
Oliver Kors joins us from the University of Göttingen, where he's a senior physician. Great to have you on the show. You found COVID-19 can affect the kidneys early on, and that can be detected in a urine sample. What's that mean for the course of the disease?
Yes, indeed. Well, we know that a subgroup of patients with COVID-19 gets sicker than others. So days after onset of the symptoms, we know that some need ICU care and have a high mortality. So our idea actually was to use the urine to identify the subgroup earlier in terms of, well, once the urine gets positive in terms of multi-organ infection, it tells us that this patient is at risk. So actually we use this urine sample to identify you as a multi-organ failure patient at risk.
So this is a good warning sign of a serious infection. Are there other warning signs too?
Yes, I think there are. However, if you imagine yourself being infected as a COVID-19 patient, being at home in quarantine, it is hard for your family doctor to check you every day for all different signs of organ failure. So if you use this urine dipstick, it's easy to use like a pregnancy test. It makes it a lot easier for your family doctor to identify you earlier that you are at risk. So once you are identified, the family doctor will take a closer look or even transfer you to the hospital.
What about knowing yourself whether or not you're at risk before it even gets that far? I mean, some people have mild symptoms, some have none, others get really sick. Does it all come down to how healthy we are?
It's a very good question that is very hard to answer because we are still in the learning phase in COVID-19, and data are confusing everywhere in the world. So let me pick two factors that I think are quite important here. The first factor is bad luck. So if you are a male in your 50s or 60s, and if your immune system simply overacts, and we don't know why some immune systems overact, you become seriously ill. Some other factors, of course, are being overweight, being a smoker, and that also play a role here. And the second, I think even more important factor is exposure. So the higher the virus load you are exposed to, the higher your risk is. So think of this people being in après-ski parties. They really had a high exposure. And by the way, the highest exposure actually have the healthcare workers at the emergency departments and ICUs being exposed to severely ill patients. So please be aware that the healthcare workers are at the highest risk here.
Yeah, definitely. When it comes back to the patient, if they tick all the boxes and are sure to get seriously ill, what measures can you take?
Well, just to make sure that this is not an official recommendation by myself or a university hospital. So my personal opinion here is, well, if our algorithm, including the urine dipstick, tells you that this patient is at risk, I would consider 2 points. The first point is to anticoagulate yourself more aggressively to prevent thromboembolic events, because we know that thromboembolic events are a major killer in this setting. And the second point is that once you are at risk to deteriorate, it would be very tempting to start the antiviral medications we actually have earlier before you get sicker.
Briefly, as far as the length of time that patients can suffer, is it possible to predict the extent of damage?
We simply do not know. It would not be fair to give you a clear answer here. We just don't know enough about the long-term consequences of COVID-19. For sure, we know at present that this is a multidisciplinary discipline we need to take care of. So we for sure need all the internists specialties after this infection to make sure that, for example, the chronic renal failure you might suffer after this infection is detected and treated.
Senior Physician Oliver Groß at the University of Göttingen. Thank you very much for joining us today. Your turn to ask the questions. If you haven't already, get in contact on our YouTube channel. We'll get our science correspondent Derek Williams to look into any topics you bring up.
Do people living with HIV have an increased chance of dying from COVID-19?
A number of different studies have looked at this issue, and although the data is still pretty limited, mostly they agree that people who are living with HIV and that are on an effective treatment program with antiviral medication are not any more likely to contract or die from COVID-19 than people who don't have HIV. The U.S. Centers for Disease Control currently lists having the immunodeficiency disease as only maybe affecting outcomes. A key aspect of that, though, is certainly going to be whether or not HIV patients continue to get the antiviral therapies that are keeping their disease in check. The United Nations program that's responsible for global action on HIV has warned that in 2020 there could be up to 500,000 additional AIDS deaths in sub-Saharan Africa alone, caused not by patients catching COVID-19, but because it's disrupting supply lines for it and access to the medications that those patients need to survive. That would basically wipe out all of the progress that's been made in the fight against AIDS over the last decade.